I cannot believe we think we could solve the quality and safety and value proposition without having our patients and family members around the table. And to those that say, well, I'm a physician, but I'm also a patient. Yes, you are, but you still come from a different mindset, and you still don't see things the way our patient and families see them. They bring a whole different perspective to it.
I don't think they have given us anything that the council as a whole have not felt they wanted to take the challenge on. The items that the council have worked on have had an impact on the guidelines and the policies that the hospital have implemented.
I do think having patients and families involved in improvement work is crucial. It's not just about patient satisfaction scores, it's really about moving the organization's level of professionalism up.
There are always questions that we as clinicians can't answer, things that affect our patients' experience. We're not the experts, but they are. We need to have the patient-family viewpoint at the center of all our decisions.
And it takes leadership from the board, but I think especially leadership from the executive suite.
Anything you can do to increase performance is going to give you an edge. And I'm here to tell you, patients and family councils can help you do it. You're going to hear things from those members that you're just not going to hear anywhere else.
And your biggest fear, of course, is that you'll get people on there that really don't have anything but a bone to pick with the hospital.
We have to kind of dismantle that fear because, like a lot of fear, it's irrational. People actually sue less if you talk to them after a bad outcome. They don't sue more.
I think it's a little odd that people wait until they get beaten up in the press because the community hears about a bad event. We have 200 to 400,000 deaths occurring every year from preventable medical harm. If you think that they're occurring at 30% of the hospitals and the other 70% are totally air-free, you're kidding yourself.
As you share data and information, you get much richer conversations and discussions around what it means and what can be done about it. It's hard to imagine not having them involved. I just can't imagine that.
In fact, I think it would be a problem if you didn't have an advisory group because I think you're missing a big part of your community.
Major systems in this country are prioritizing it and putting resources into building PFACQS. So if your hospital hasn't done it yet, you're behind.
Don't be skeptical, just you need to jump in and do this. It's really a great way to receive feedback in terms of the organization in an unbiased way.
I would say you have to try it. You will be amazed.